I grew up with a hospital just blocks from my house, and my neighbor was a nurse. And so from the time I was little, I watched her. She worked evening shift, and her kids and my sister and I, we were best friends. So my mom got the kids until her husband got home. She'd walk up the street in her white uniform and white hat, and she'd stop back at my house to have a glass of wine at the end of the evening with my mom, and I'd listen to the stories and I'd think, I just want to be a nurse. So from the time I was in kindergarten, I was a nurse for Halloween for my entire life. And then when I graduated high school, I went in the military and spent about 9 years between active duty and Air National Guard, and started my family and realized working 60 hours a week, I just couldn't keep up. So my husband said, you always wanted to be a nurse, go back to school. So I went to the University of Maryland School of Nursing and got my bachelor's, and started at what then was North Arundel. They had just been, University of Maryland had just purchased them. So went through that transition, stayed with them until probably about 20, I don't want to get the years wrong, but for a length of time, 2017, 18. And then I went to Cap Region, which they were in the transition and building a new hospital. And then I left them before they completed their hospital and went to GW, as I stated, and really wanted to get back to the University of Maryland system because it's a great system. I had relationships there. I understood what was expected of me, and this opportunity opened up at Shore. And I started as a director of patient care services. And from there, the CNO position opened. And so August of 2024, I took the position for Chief Nursing Officer. Right now, we're experiencing a huge, between what happened during COVID and nurses retiring, and just the complexity of healthcare makes them burn out very quickly. So it's hard to attract, retain, and keep nurses right now. I will say that Shore Regional Health is really doing a great job in some of our partnerships with Chesapeake College. We've just begun, I believe, developing a partnership with Salisbury University. And then through our affiliation with the University of Maryland and the School of Nursing, beginning to, through some of our ACE and P3 programs, have really been seeing an influx of applicants and new grads coming to Shore. So quickly reducing our agency numbers. I believe we're almost at 20 students that'll be starting with us after graduation this spring. I think there's some excitement around the new regional medical center. I think that people are beginning to look for more solid careers. I really think that during COVID, it deterred a lot of people from wanting to go into healthcare. And now people are seeing it as a great opportunity. And there's been a lot of publicity around nursing careers and what you can do as a nurse. So I think that that's helping us. People want a starting point. Now they're starting a little bit later. I see students who maybe graduated high school, took some time off, and are now looking to go back to school. The benefits are you can do it all your life. There's always something for a nurse to do. Between working at a hospital, working at a physician's office, working in schools, consulting, our health departments, there is just such a number of positions and roles that nurses can do. I feel like it's one of those, you can start at 18 in your heavy-paced emergency department, and then you end up in case management, really helping people find placement and get the care that they need. Shore Health is small enough where you know everybody that you work with, and then we're big enough to be challenged every single day. I also think the benefit is having the relationship and being a part of the University of Maryland medical system. The resources that are available through that relationship are just truly unbelievable. Our staff members get to, we have, what do I want to say? We'll have clinical groups, like we have an OB group. So members of the OB team across the system, across our member organizations, meet on a regular basis. They share best practices, what they're doing. They look to solve problems together. And when you're an independent hospital, you don't have the benefit of that. So really, it's very, very collaborative. Yes, at Shore Regional Health, we have the 2 hospitals, we have many outpatient facilities. Getting your foot in the door and really understanding what you want, because it's not just nursing, right? There's radiology, there is lab, there's so many ways you can go, and I think some people don't know. They know they want to get into healthcare, but they're not sure what they want to do. So getting your foot in the door, taking opportunities to visit different departments, understand what they do, find your passion. I think that that's important. But if you can get your door in at Shore Regional Health, we will help you with your path. You will find it. Yeah, so the UMS career site is really the best place to start. And on the UMS career site, you will see all of the positions that are listed for Shore Regional Health and all of our other member organizations. And then from there, if you can apply for something. But I encourage people, reach out. If there is someone, what I say about Shore is everybody knows somebody who works there. So get in touch with that person and make a personal connection. I will say sometimes people feel like they get lost, and they get lost in that recruiting process. So make a phone call, send an email. I think all of our email addresses are available on public websites. So I'm happy to help support anybody who wants to get into any discipline. Magnet is a designation of excellence for a healthcare facility. And it is primarily about nursing, but we cannot do it without our collaborative partners. So without our pharmacy and our docs and everybody working collaboratively, we could not get there. And it really signifies that we provide high quality care. We engage nursing in working at top of their license and doing research and adopting best practices, and really support the bedside nurse in outcomes for our patients. Oh, yes. So the University of Maryland Medical System provides $5,000, it might be a little bit more than $5,000 in tuition reimbursement. So that is offered to you. Our foundation at Easton is extremely generous. There is a foundation scholarship program that they can go through, apply for, and obtain. And then there are many, many opportunities through our Career Pathways program. And also our local Chesapeake College has great opportunities and scholarships as well. So for immediate things that happen in the hospital, if there's an event or something that is causing stress to any of our team members, we have something called a RISE program, which is resilience in stressful events. And we have team members who have been trained and are on call 24 hours a day. So they can pick up the phone at any time and call our RISE person, and they will get support that way. In addition to that, there's our emergency assistance program that the employees get through their benefits. We also have a fund committee, and our fund committee provides events throughout the year to really engage in fun and bonding and to begin those relationships. And I think so much of getting through your day is having good relationships with your coworkers. They become your family, you rely on them. And then our managers and our at the front lines recognizing that somebody's having a bad day and they may need to go home early or take a few days off, or maybe they need a different assignment. But I really think having your leaders in tune with staff to be able to recognize that and then work with that team member to understand what they need. And we talk about it in our leadership meetings all the time. How are staff doing? What can we do for them? And the good thing about nursing, you work in the emergency department, where I think is an extremely stressful area, and you find yourself getting burned out, you can go somewhere else. You don't have to leave the organization and lose your benefits, right? You can take a break and maybe go to a different department, see something different, and then come back to it if you want, or maybe you'll find your joy there. When I think about my career, there were times where I worked 8-hour shifts 5 days a week. There are times that I went to night shift so that I could be home with my kids during the day. My husband was military, so I needed an employer that was flexible, and nursing was it. It really allowed me. I did weekend option for a while, so lots and lots of flexibility and variety in the positions. And what is so special about this new regional medical center, I think from a community perspective, it's something that they've been waiting for, so they're excited about it. Which helps our staff to be excited about it, right? When the community is asking you about it, the staff get excited to be a part of something great like this. We are truly looking at innovation and technology in this new regional medical center. So all of our rooms will what I would consider a smart room. We'll have technology for entertainment and education and teleconsults. And these teleconsults really connect us with specialties across the bridge that we may not be able to have here. So we're able to do that here. The technology is a little bit different than what we'll have in the regional medical center. We're also creating a center of excellence for education. So working to build a simulation lab that's going to incorporate not only simulation, but virtual reality. And we'll be able to use that with all disciplines.
Yeah. Pretty great.
Yeah, it's really exciting. And our staff members right now, we're in a concept of operation phase of building the hospital where we're looking at our workflows. How will they be different in the new regional medical center, and how will we incorporate this technology? And our bedside staff are building those workflows. So they get to have their hand in it from now until the time they walk through the door.
And it's Nurses Week.
It is Nurses Week. Nurses Week is May 6th through 12th. So the first Nurses Week was in, 1954. But it never really got solidified until, I want to say it was in the 90s, when they finally settled on May 6th through the 12th was going to be Nurses Week. It ends on Florence Nightingale's birthday.
And what takes place?
So at Shore Regional Health, we kick it off with a Nursing Excellence Award ceremony. So we do that at Chesapeake College, and we recognize nurses for their leadership, their participation in professional development. We recognize a new nurse, and nurses who are aspiring to do great things. So we kick it off this year we're kicking it off on the 5th, Monday night, but Nurses Week starts on the 6th. And then throughout the week, we have pet therapy comes in. We have all of the nursing units do different things. They're decorating nursing stations. We do a spirit week on Wednesday. All of the nurses dress, we call it White Wednesday. So all the nurses will dress in, not all, the ones who want to participate will dress in all white and walk the halls. It's really fun.